Tonight, hopefully, we cover a fair bit of info that maybe you haven't seen before. We're going to go through a lot of practical component, but I will present some stuff initially that just go through risk factors and things we know about each of the components of hamstring, quads and calf. But we'll give you time at the end to ask some questions about other areas, because obviously they're not the only soft tissue injuries. I always start with the prophylactic component, and I think it's fair to say that before we treat any soft tissue lesions, we should probably try and prevent them. And so what I'm going to give you is a little bit of an insight into what we would do at an elite level, and there's a lot of carryover to amateur clubs as well that may give you a couple of little hints about how we can prevent them. So from a physio point of view, we would always do a pre-season screening, as a lot of people do at an amateur level. And the most important part of that screening is that you act on it, okay? And whenever I lecture on this, I always highlight that, because there's a lot of people that we see that have had a good screening and nothing's come of it. So you're aiming to find deficits and you're aiming to act on them, so that next time you screen someone, you've changed something.